Hi, Mr. Rowe. How are you today?
Good.
My name is Kara Gillison. I'm from the University of St. Augustine. I'm an occupational therapy student. I'm going to be working with you today. I hear you come in recently with a right posterior hip replacement. Is that correct?
Yeah.
Okay. I know we discussed recently your goal was to put on and take off your pants, socks, and shoes with adaptive equipment with setup before discharge. Is that correct? Okay, before we start today, because I'm going to be demonstrating the adaptive equipment to you and putting on your pants, socks, and shoes, I just wanted to go over briefly your hip precautions. Are you familiar with your hip precautions? No. Okay, so your hip precautions, we don't want you to bend past 90 degrees like this. Okay. We don't want you to cross the leg like that. No crossing the leg, the right over the left, and no bringing your toes inward. So twisting the hip and bringing the toes inward. Can you repeat those back to me?
No bending at the hip.
Here, I brought you a sheet so you can kind of view what we have discussed. So the first precaution is?
Don't bend your hip past 90.
Okay.
Don't cross your legs. Don't twist your hip inwards. Keep knees and toes pointed upwards.
Okay, correct. Do you understand those?
Yep.
Okay. So now I'm going to go through the putting on your pants first using a reacher. So we're going to do this all simulated today. So we're going to be putting our pants over on top of our pants, our socks on top of our socks, and our shoes as well. So I'm going to begin with the pants. So what I'm going to have you do first, and this is the reacher, this is what's going to help you put on your pants. So what I'm going to do first is I'm going to take the right leg, so we're going to dress the affected leg first. I'm going to roll the pant leg all the way up, take our reacher, and grab the rolled part up. So I have a whole opening so we can bring the pant leg down, and you can slip your foot through the pant leg and try to slide it all the way up and bring it to about your knee. Now we're going to do the left side. So I'm going to take the left pant leg, roll it all the way up, grab a good portion so we can see the hole, grab it with the reacher, bring it down, and we're going to slide the left leg in. And we're going to bring it to about our knees.
So I can't bend forward and
No,
do that?
No. This leg, you can bend your knee, but no bending past the 90 degrees. So we're going to get it to our knees. I'm going to set this reacher down. Now I want you to, we're going to stand up and pull the rest of the pants up over our bottom. So I'm going to have you extend your leg out, the right leg, the affected leg, the one that had the surgery. You're going to place your arms on the armrest, and you're going to push yourself up, maintaining an upright posture. And I'm going to do it in 3. 1, 2, 3. I'm going to stand up. I'm going to bring the affected leg back underneath me, and I'm going to pull these pants all the way up. And then I'm going to slowly descend back down. I'm going to reach for the armrest, straighten my leg out, maintaining upright posture, and sit back down. All not breaking my hip precautions. Next thing I'm going to do is we're going to do the socks using our sock aid. So what I'm going to have you do is take the sock at the opening. I want you to have the U facing outward, strings towards you. We're going to take the sock and we're going to place it over the U portion of the sock aid, bunching it all the way through, getting up to about the knots. We're going to drop the sock aid down. You can still bend your knees, that's okay. We're going to place the foot inside the sock aid, grab both sides of the string, and you're going to pull it all the way up. You're going to drop the sock aid down, take your reacher, and grab it and bring it back to you, and we're going to do the left side. So, same thing on the left, take the sock, bring it over the U, push it all the way up, drop it down, grab it all the way up, drop it down, and then I can grab it. And the last portion of the putting on the pants, socks, and shoes is the shoes. So I'm going to bring the shoe down in my reacher so I don't bend down, I don't break my hip precautions.
Can you throw the shoes down?
You can throw the shoes down, but it's probably safer to put the shoe down with the reacher. Because you might twist your hip or twist it outward or inward. So again, that's breaking your hip precautions. So what I'm going to do, because I can still bend my knee, I'm going to place the shoe horn in the back of the heel portion, and I'm just going to push my foot through like that. I'm going to take the other shoe, put it down, place the shoe horn on the back of the heel, and then slide my foot down in there. And now we have donned our pants, our socks, and our shoes with the adaptive equipment. So now we're going to doff. So doffing is taking off and donning is putting on. So now we're going to doff it. So again, you can use the shoe horn, push the shoe off through the back, push the shoe off through the back. So now we've taken off our shoes, we can just leave them down there on the floor. I'll push them to the front with the reacher. Now I'm going to take off my socks using this reacher. Place it over there with my shoe. Still maintaining my hip precautions the whole time. Getting the sock off. And then our final is we're going to stand up. We're going to bring our pants to our knees. And then the rest of the way we're going to take it off with the reacher. So I'm going to place my hands on the armrest, stick my right leg straight out. I'm going to maintain an upright posture. I'm going to come up. So yeah, I'm going to redo that. So I'm going to bring my leg up. I'm going to bring my pants down to my hip or my knees. Reach back. Straight leg out, this down, and then I'm going to take the reacher, push the pants off, okay? And now we've doffed, taken off our pants, socks, and shoes. Okay, so now I'd like you to demonstrate it, and I will talk you through the whole through everything. So first,
start with the pants.
Yes, we're going to start with the pants. So let me set them up for you. And once you stand up to put the pants on, I'm going to stand by you. I'm going to be on your right side, just because we don't have a walker here today. So I'm going to have you dress your affected leg first.
So I have to roll that up, right?
Mm-hmm. Correct.
Okay.
Okay, so you're going to take the reacher,
Mm-hmm.
and you're going to, you're going to try to grab the,
Okay.
You're going to bring it down to your right leg and see if you can slip your foot through that hole, that opening. Try to drag it up to your knee.
Okay.
Up to your knee. Okay, now you can let go of that. See if you can bring it up to your knee.
I can reach for it like that?
Mm-hmm.
Okay.
So now we're going to take the left leg,
Roll it up?
roll it up. reacher. See if you can get it down to your.
Pull this leg out, right?
You're gonna put it over your left leg, and that's okay. You can twist because that's not your operated leg. I have to redo that. So take it off, and reposition your reacher. You got to make sure you're grabbing. You have it. You got to make sure that hole is exposed there. See that?
Mm-hmm.
Okay, grab it.
Mm-hmm.
You hold down on it?
Yep.
Okay. So. Yeah. So we'll have to work on that side.
Okay.
Alright. So set your reacher to the side. So now I want you to bring this knee back underneath you.
Mm-hmm.
So do you remember how to stand up, maintaining your hip precautions?
Straight up.
So slide yourself to the edge of the chair. Yep. Keep that straight leg out, the right leg out.
Push
Nope.
up.
Now push up to stand. And then try to maintain more of an upright posture going up.
Mm-hmm.
So you're going to just reach down with your right. We probably have to bring that up a little bit further on you, because you were bending a little bit past your knees, your hips. Okay, and you're gonna reach back, right, left, stick out that right leg, and then sit down. Good. Okay, so we're gonna do, what are we doing next? The socks? Okay, so
Let's see if they're so tight. This one having problems.
oh, okay, we'll have to practice with some looser pants the next time when I come. So here's the socky.
It's gonna be tough.
So
That socks
you
on.
remember how to put it on the socky?
Yeah, push it over like this. Like that.
Mm-hmm. I'll make sure this is, you want to just go to the knots.
Mm-hmm.
You don't want it to, you want this part to be exposed.
Okay.
So you're going to take one hand, drop it down. You can take your reacher and grab for it if you made a mistake with that.
I can't bend forward, right?
You know, just drop it down.
Okay. Push it with my
You can push it with your other foot. So I'm going to set it up for you. I want you to grab the rope with the right hand and the left hand. Okay, and you just raise your foot off the floor and start jimmying it up over your foot. Try not to bring your toes in and out.
That good?
Okay, so just drop it down. And then I want you to grab it with the reacher. And you still want you to maintain your hip precautions. And we're going to try it with the other sock. You feel comfortable with that?
Oh, yeah.
Or something you need to keep practicing?
I think that would need to be practiced.
Okay. So just drop it down.
Oh, because I have clothes on.
Yeah, well, like I said, this is all stimulated. Once we start doing it the real way without all this extra clothing over, it'll be a lot easier. So. Hope you got that side.
Mhm.
Good.
Should I pull the socks up?
If you need to pull the socks up, you can take your reacher. If you want to adjust them, yeah, you pull them up. I don't know how much you're going to be able to get it up.
It's good.
No, this one. This is good. Okay.
I know when I put my shoes on. All right.
Just try the best.
Okay.
So we're gonna do the shoes.
Okay.
So I'm gonna have you give you the wrong shoe. Here's the right shoe.
Just throw it on the ground.
No, because I want you to maintain your hip precautions. You might break it when you do that. So take the reacher. I'll hold this for you.
Mm-hmm.
And just place it on the ground. Put it somewhere in the middle.
There.
Yep. Hold the reacher for you. Then we're gonna take our socket or the shoe horn,
Mm-hmm.
and then you're gonna bring your foot over. Bend your knee back. You can flex your knee. Okay, that's good. That's good. You feel pretty comfortable with that? That's good.
All right.
Let's try the other one. I'm gonna hold this for you. Just put the shoe down. Put it somewhere in the middle.
About there.
Yep. And then we're gonna take the shoe horn. And you gotta remember, you can bend your knee. Yeah, this
I
is.
can't bend forward.
No.
I need to bring it closer.
Yep, you can use your. Just try to get it in there the best you can. Yeah, remember you have like 2 pairs of socks. Okay?
Okay.
And pull it out. Okay, so how do you feel doing all those? Putting.
A little
Done.
awkward, but with
Done.
time it would probably get easier.
Okay, so that would be your goal that we want to try to set up for you is donning or putting on your pants,
Mm-hmm.
shoes, and socks using the adaptive equipment
Okay.
and maintaining your hip precautions. And you remember what your hip precautions are. Don't bend past 90 degrees.
Don't twist.
Don't twist, and no crossing your
No
legs.
crossing.
Okay, so I just want you to, let's go work through taking off or donning
Okay.
the shoes first. We'll start with the shoes. So
Okay.
I want you to grab the shoe horn,
Okay.
okay? And we'll start with the right, with your affected leg. Just try to see if we can get those off.
Okay.
And the left, I'm gonna try the left. Okay, so we're gonna take off the socks, and how did I demonstrate taking off the socks? Using the,
Reacher.
yep. So we're gonna take off our right sock, the affected leg. You might wanna work it with the outside, when I did
Over
it.
here?
Mhm. But don't try not to twist your leg to, your foot inward. We said that's breaking your hip precautions. So you're gonna, just be careful with that. And then you might have to switch the reacher to the inside. All right, and now we're gonna get the left off.
You like to move this way, right?
Mhm. You can bend your knees on both sides. We just don't want you to bend past that 90 degrees of hip flexion. Okay?
Okay.
So we're gonna put the reacher down. Are you pretty comfortable taking the shoes and socks off with the equipment?
I think with practice it would become a lot easier.
Okay. So the last thing we're gonna do is the pants. So
Stand up.
first you're gonna have to push yourself forward. You're gonna bring this foot underneath it. No. Right there. A little bit further. You're gonna stick your right leg out, and you're gonna come straight up to stand. Okay? You're gonna jimmy your pants down.
Stand on that.
Mm-hmm. Just jimmy them down. Okay?
Mm-hmm.
And you're gonna reach back, sticking the right leg out. Try and maintain that upright, yep. Okay, you might have to kind of jimmy them off your legs a little bit. And then, so the final thing is,
I can get it down to my
Yep.
ankles.
Try not to bend past it. I would just go to the knees, because you're still bending past that hip at 90 degrees.
Okay.
So the last thing is you're gonna take the reacher,
Okay.
because we don't want you to bend past that 90 degrees, so
Right.
take them off or doff them, and you're gonna try to pull them off.
I think most people would probably try to kick them off. Good.
Okay, any questions?
I think with time and practice, it would probably become a little easier.
So you know your goal with occupational therapy, we're working on trying to don and doff your socks, shoes, and pants with the adaptive equipment, which is the socky, reacher, and shoehorn with setup before discharge. Do you have any questions for me today?
I have no questions. Thank you so
All
much.
right, thank you.
Thank you.
It was nice meeting you, and I'll be working with you again soon.
Thank you.